Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's look at the modified Duke's criteria. Modified Duke's criteria. So modified Duke's criteria, this is specifically for the infective endocarditis. Infective endocarditis. So under this, it is given by two criteria, that is pathological as well as a clinical criteria. So there is first the pathological, next comes the clinical criteria. So if clinical criteria are used, the definitive endocarditis is defined as, so there is a certain number of major criteria and minor criteria. So the presence of two major, so you should have two major, or you should have one major plus three minor. So you're supposed to have two major or one major plus three minor, or there should be five minor criteria. Five minor criteria. Now let's look at some information about the updated modified Duke's criteria for infective endocarditis. This is as per the 2023. So as per this, first is the pathological criteria. So under this pathological criteria, the microorganisms, they are identified in the context of the clinical signs of the active endocarditis in any of the following. So it includes in one of the following, that is, it includes vegetation. It can include the cardiac tissue. Next, the explanted prosthetic valve or sewing ring. Next, there can be ascending aortic graft as well as endovascular, intracardiac, implantable electronic devices. So we call it as the CIED. Next, there is also the arterial in case of arterial embolus. Then we move on to the type 2. So under this type 2, what do we have? There is active endocarditis. The second criteria, that is, there can be active endocarditis. So this may be acute, subacute, or chronic, and it is identified in one of the following. That is, again, it can be due to vegetation, cardiac tissue, the expandable prosthetic valve, the ascending aortic graft, then CIED, as well as the embolus. And other thing to note is the microbiology identified by PCR, amplicon, the metagenic sequencing, or in situ hybridization. So microscopy is by PCR, amplicon. Next, there is metagenomic sequencing, metagenomic sequencing, or in situ hybridization. In situ hybridization. Now let's move on to the clinical criteria. So under clinical criteria, we again divide it into the major and the minor. So let's go into the clinical criteria. Under clinical criteria, we are looking at the major criteria. So first is there, it is divided into microbiology, then comes imaging, as well as next is surgical. So first, microbiology. Under microbiology, there is a positive blood culture. The first one is positive blood culture. So under this positive blood culture, this is the major criteria and can be met if any of the following is satisfied. That is, what is the first one? The first one is isolation of microorganisms commonly causing the infective endocarditis. So commonly causing organisms of the infective endocarditis from two or more separated blood culture sets. So two or more separated culture sets. Next is there is Isolation of microorganisms, occasionally or rarely causing the infective endocarditis in three or more separate blood culture. So the common organisms of infective endocarditis, that is two or more separate culture sets. The second one is that is microorganisms which occasional microorganisms causing infective endocarditis. This has to be three or more separate. So it is three or more separate culture sets. The next is we move on to the positive lab test. So let's go on to this is again another part of the microbiology. So positive lab test. So here in positive lab test, this is a major criteria and it also can be met in case of one of the following is satisfied. What is the first one? The first one is there is a positive PCR. There is in case of the positive PCR or other nucleic acid based techniques for the specific microorganisms. So positive PCR or other nucleic acid based techniques, and this is very specific to certain microorganisms such as the Coxiella burnetii. Next is Bartonella species. Then comes the Tropharema whipple. So Tropharema whipple, and this is from the blood. From the blood. Next is the Coxiella burnetii antiphase IgG antibody titer. There is Coxiella burnetii antiphase IgG antibody titer greater than 1 is to 800, or the isolations from a single blood culture, or isolation from single cell culture, blood culture. Next we move on to there is the indirect immunofluorescence assay. So we call it as IFA. So IFA showing the IgM and IgG antibodies. So it shows the IgG as well as the IgM antibodies, and this is to the Bartonella henselae or the Bartonella quintana. So this is with the Bartonella henselae, Bartonella henselae, or the Bartonella quintana, and this is with the IgG titer of greater than equal to 1 is to 800. So IgG titer that is greater than equal to 1 is to 800. So there were three under positive lab cultures. First was the positive PCR. Second one the Coxiella burnetii antiphase IgG antibody titer greater than 1 is to 800. Then came the IFA showing IgM and IgG antibodies to the Bartonella henselae or the Bartonella quintana with the IgG titer greater than 1 is to 800. Next, we move on to the imaging aspect. So here in imaging, there is the echocardiography and the cardiac CT monitoring imaging. So echocardiography, and the cardiac CT imaging. So these two are the first one. So what does it do? So is that it detects the anatomical evidence. So anatomical evidence of the infective endocarditis, that is valvular leaflet perforations, aneurysm, abscess, or the intracardiac fistulas. So anatomy of the infective endocarditis evidence. Second one is they do the significant new vascular regurgitation. So the significant new vascular valvular. So there is a new valvular regurgitation. Regurgitation. Now moving on, there is a new partial dehiscence of the prosthetic valve. So also to detect new partial dehiscence. New partial dehiscence, and this is nothing but of the prosthetic valve. So this was about the echocardiography and the CT findings. This is one of the imaging. So the other imaging options are the FDG, PET and CT imaging, PET as well as the CT imaging. So this is now recognized as a valuable imaging modality and in case of the prosthetic valve endocarditis. So this is in case of the prosthetic valve endocarditis. It's known as the PVE or greater than 3 months of the cardiac surgery. So greater than 3 months of the cardiac surgery. And when the echocardiography is inconclusive. So it is recognized as a valuable imaging modality in cases of prosthetic valve endocarditis, that is we have written as PVE, or greater than 3 months of the cardiac surgery, or greater than 3 months of cardiac surgery, and when the echo is inconclusive. The third category, the final one, first was microbiology under the major criteria, which had the positive blood culture and the positive lab test. Next, under imaging, there were two, that is ENF, that is echocardiography, and the PDG. And now we move on to the surgical. So, under surgical, there is a intraoperative evidence of the infective endocarditis. So, there is intraop. You look for intra-op evidence of infective endocarditis, and such as the vegetation abscess, valvular destruction, where other definitive criteria are lacking. So this can include vegetation, abscess, the valvular destruction, where the other definitive criteria are lacking. Now, this was about the major. Now let's dive into the minor. So before we go to the minor, let's look at the clinical criteria once more. Recap. So to suit the criteria, there has to be two major or one major plus two minor, three minor, or there can be five minor. So this is the criteria overall. Now let's dive into the minor criteria. So under minor criteria, first is the predisposition. So under predisposition, what are the categories? So predisposition, it refers to the previous history of or past history of the infective endocarditis. Next, the presence of the prosthetic valve repair, the CHDs, congenital heart disease. Next, it can include the more than the mild regurgitation or stenosis of any etiology. So more than the mild regurgitation, greater than the mild regurgitation or the stenosis of any etiology. Next, it can be CIED, that is endovascular cardiac implantable electronic devices, CIED. Then comes the hypertrophic obstructive cardiomyopathy, we call it HOCM, as well as the history of injection drug use. So, history of injection drug use. Next, we move on to, so this was about the predisposition under the minor criteria. After the predisposition, we have the fever. So under fever, we talk about the temperature. The temperature is greater than 38 degrees Celsius. So greater than 38 degrees Celsius in Fahrenheit, we call it 100.4 degree Fahrenheit. Then comes the talk on the vascular. So under vascular, there is a major arterial emboli. So there can be major arterial emboli. Also look for the septic pulmonary infarcts. We are writing it as SPI, septic pulmonary infarcts. Then comes the septic pulmonary infarcts, myocardial aneurysms, myotic aneurysms, intracranial hemorrhage, the conjunctival hemorrhage, the purulent purpura, the Janway lesions, and as well as the splenic and the cerebral abscess. So all these are present under the vascular. Next, as we move on, we look at the immunological evidence. So what do we have in the immunological evidence? So under immunological evidence, it can be the immune complex mediated glomerulonephritis. So it is immune complex, IC, immune complex mediated glomerulonephritis. Next, there can also be presence of the Osler nodes, the Roth spots, as well as a positive rheumatic factor. Positive rheumatic factor, R factor. Then we move on to the microbiological. So what is present in the microbiological? Under microbiological, there is a positive blood culture, and this is for the microorganism consistent with the IE and not meeting the major criteria requirements. So first is the positive blood culture. The second one, and other thing to note is this is which is not meeting the major criteria. Not meeting the major criteria. Second one is the PCR. This is under microbiological. PCR or amplicon or genomic sequencing evidence of typical pathogen. So we talk about PCR or the amplicon or genomic sequencing. Genomic sequencing evidence of the typical pathogen. Typical pathogen. Next, we move on to the imaging aspect. Under imaging, there is the PET and the CT. So PET CT. The PET CT evidence showing in less than 3 months of cardiac surgery. So less than 3 months in the cardiac surgery. Cardiac surgery. Then we look at the physical examination. Next topic of discussion is the physical examination. So all this is under the minor criteria. Physical examination is we look for the new auscultation or the of the regurgitation murmur. The new auscultation of regurgitation murmur. New auscultation of the regurgitation murmur. And this is when the echocardiography is when echo is unavailable. Echo is unavailable. So this was all about the Duke's criteria, modified Duke's criteria for the infective endocarditis. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.